Good afternoon and welcome to Ken Cable 21. My name is Lucy Aquino and I'm the Chief Executive Officer of Hispano Care, a program of Advocate Illinois Masonic Medical Center. Today, you're watching a live interactive show, and of course, it's on health. With me today, we're going to be talking on the topic of colon cancer and the prevention thereof. We also invite you, our viewers, to give us a call. The number's at the bottom of your screen at area code 312-738-1060. The lines are now open. Joining me today is Dr. Jan Kaminski. Dr. Kaminski, welcome and thank you for being on the show.
Thank you, my pleasure.
And Dr. Kaminski, you're a specialist of colon and rectal, you're a colon and rectal surgeon, and you're affiliated with Advocate Illinois Masonic Medical Center. Thank you for being on the show. This topic is just so important, and I know that there are times that we're discussing so many disease states and what can be preventive and what can be done. But I know that colon cancer, these numbers are just so surprising every time I see them and look at them. And they're saying, according to the American Cancer Society, that approximately 140,000 people are diagnosed with colon cancer in the United States, and over 50,000 people are predicted to die from it annually, in both men and women, and that colon cancer is the third most commonly diagnosed cancer and the third leading cause of cancer death. Doctor, what is going on?
Yes, it's astonishing with the numbers. I myself see this every day, and 150,000 and 50,000 combined. If you combine men and women, it's actually the second leading cause of cancer death in the United States, colon cancer. It's we really need to spread the message, and this is one way to do it, which I think is a great idea.
Absolutely. So, doctor, obviously, the need to raise awareness of colon cancer is definitely something that needs to be done. And so let's start by asking the question, what is colon cancer?
So colon cancer, let's start off with what is the colon? Colon is a muscular tube. It's part of the digestive tract. And so when you eat, you put food in your mouth, it goes down your esophagus. We actually have a nice picture here.
Well, why don't we bring this up?
So when you eat food, it goes down the esophagus, down into your stomach, and then into the small intestine. As you can see, it's in the middle. The small intestine is about 20 feet in length. And then from the small intestine, after it absorbs all the nutrients, it goes into the colon. The colon's job is mainly to absorb water, absorb the rest of the nutrients, and it's also a storage mechanism for stool. And that's the last 5 feet, is the colon and the rectum.
Wow, that's pretty interesting. 20 feet of colon.
20 feet of small bowel, 5 feet of colon.
Whoa.
5 feet of colon. Yeah.
Wow. So doctor, so that's the process it takes. But how do you know, or what should you do in order to prevent colon cancer? What are some things that we should do?
So, just to back up, the colon cancer itself is abnormality in the cells of the lining of the colon. They grow on an abnormal basis. It starts off with a tumor, and then it can spread to other organs of the body. There's certain things that we can do to prevent colon cancer, and the biggest thing is a simple procedure known as a colonoscopy.
Okay. And so, in order to, well, I think before we get to actually a colonoscopy, and obviously there are some age limitations there as well, but in order to prevent, are there symptoms, first of all, and secondly, when should someone go for a colonoscopy?
Okay, so there's certain signs and symptoms, or there's certain things that one can do to prevent. There's certain things that you cannot do to prevent. Age is one of them, and genetics is another. But environment, such as how healthy you eat, exercise, smoking, alcohol, obesity, all these things are preventative measures that one has control over, and and not doing that will prevent, will help decrease the risk of colon and rectal cancer.
And so, are there actual symptoms for colon cancer?
That's a great question. There are. That's the short answer. The longer answer is that most people don't have symptoms when they have a colon cancer. So a colonoscopy is a very, very important screening tool to prevent that. However, there are other signs of colon cancer, such as one can have rectal bleeding, one can have abdominal pain, vague abdominal distension, unintentional weight loss. If you've lost 30 pounds in a month and you didn't want to, and sometimes nausea and vomiting.
So now for a colonoscopy, I'm really excited about this because as you and I were outside waiting to come on and do the show on this, the virtual colonoscopies, and I've heard pros and cons against that. Can we talk a little bit about that?
Sure. So a virtual colonoscopy is actually an imaging study. It's a CT scan, a CAT scan, where you don't have to have an invasive procedure. And it's another option for patients who can't tolerate a bowel prep or something to clean the colon out. The good thing about it is that you don't need a invasive procedure, but the downside of it is that if they find anything abnormal or if the radiologist finds anything of concern, then colonoscopy is indicated. So you would have to have that regardless.
Okay. So if you're doing a virtual CAT scan, is it right, or CT scan?
Yes.
If you're actually doing that, is there a prep for that as well?
So that depends. Usually you do want the prep, but a lot of times the patients that get the CT colonoscopy can't have the prep because of some form of obstruction. So it depends on the clinical situation. But regardless, you still would ideally want a bowel prep.
Okay. So who's usually, I know we talk about who's affected by it and who's not. And we also know that certain groups, ethnic groups, are more affected than others. Can we talk a little bit about that?
Sure. First of all, colon cancer does not discriminate. So it doesn't discriminate against race, against gender, against sexual orientation. It affects everybody. There are certain groups or certain people and individuals that are at an increased risk for colon cancer. People who have a family history of colon and rectal cancer, people who have a family history of polyps in the colon, people who have a history, personal history of cancer or personal history of polyps, and also people who have a personal history of inflammatory bowel disease, all those such as ulcerative colitis or Crohn's disease, not to be confused with inflammatory or with irritable bowel syndrome. But all those people are at higher risk for having a colon cancer, and those are the people that should ask their primary care doctor what to do next or when they should get screened.
And usually when a colonoscopy is ordered, about what age is that done?
So generally, when a patient has an average risk of colon cancer, generally the guidelines are at 50 years old. However, if you are one of those individuals with increased risk, such as the ones we mentioned before, then sometimes the screening age can be decreased, such as 40 years old or even lower.
Does hereditary play a role in this?
It does. So genetics do play a role in colon and rectal cancer. There's about 30% of people who get colon and rectal cancer are because of genetics. The other 70% is environmental.
Wow, and that's really interesting. Again, I want to invite our viewers that our lines are open. If you have a question for Dr. Jan Kaminski, please give us a call. The number's at the bottom of your screen, and that number is 312-738-1060. Doctor, I was hoping that we can walk through a beginning from prepping to the actual colonoscopy so that we can explain to our viewers what it takes and that indeed it's not as bad as people think. I mean, there's a myth out there that this procedure could be painful, it's so unbearable, it's so uncomfortable, but we know that's not true.
That's
So it would be
correct.
great if we can walk our viewers through an actual procedure.
Sure. So the actual procedure itself, the day of, is the least painful and the least uncomfortable part of the entire process. It begins with the day before, where the viewers or the patient will start by drinking a bowel preparation. It's a liquid where you drink the bowel prep to clean the entire colon out, and that can take almost the entire day.
Okay.
And no solid foods that day before. It's only a clear liquid diet.
Okay.
And that's up to midnight.
Okay.
So after you take the bowel prep and you're on a clear liquid diet, you'll be pooping all of the stuff out so that we can have a clear view of the colon for the next day. And then at midnight that day, you do not want to eat or drink anything prior to the colonoscopy. So then you wake up in the morning and you go to your doctors to get the actual procedure. And what happens is that they give you medicine that
Okay.
make you comfortable, that make you sleepy, and that they make you not remember the procedure.
It's a very little light sedation,
Light
right?
sedation,
A little light
right.
sedation.
It's like twilight anesthesia, that you kind of know what's going on, but you won't remember or feel anything. The actual procedure itself takes about 30 to 45 minutes, depending on what we find.
Okay.
And then afterwards, you can eat and drink whatever you'd like. And most of the most common symptoms after a colonoscopy are a little bit of bloating and extra gas, just because we have to inflate the colon with air.
In order to see better, right?
Right.
So, doctor, I know that you brought, these are very interesting pictures. Can we go through these really
Yes,
quick?
yes.
Okay. So, let's get this on the screen. So, doctor, what do we have here?
So here, this is an actual colon, where you can see this is the lining of the colon all the way around. This is the front and this is the back. This here is the abnormal growth that we call a polyp. This can grow out of any place from the lining of the colon, and these are the things that we look for.
So, as you're looking for these, are you also removing this during the colonoscopy?
Yes, there's we have special techniques during the colonoscopy that we utilize to remove this entire abnormal growth, so that afterwards this goes to the bucket, as we say, and and it prevents this from becoming a cancer.
Wow. So, doctor, you have another picture here that, and these are actual pictures.
These are actual pictures
right?
of patients, correct. So this is after this is after we remove the polyp. You can see here. So this will just turn into a scar, and the mucosa of the lining of the colon is, very nicely heals up afterwards.
Now, while you're doing this procedure and it heals, you said, and is there pain related to this at all afterwards?
So after the biggest discomfort that the patient can have is a little bit of bloating and some gas.
So even with the removal of this, you really don't feel it?
Right. Even removing this, you don't feel it because the colon itself doesn't have nerves that detect pain.
Right. Interesting. Okay. So here's another one.
We have another example.
Can you describe us what's on here?
So the polyp before was known as a sessile polyp, and this one is known as a pedunculated polyp. The reason we differentiate it is because the pedunculated one has an actual neck, as you can see here, and then a head here. It kind of looks like a mushroom. And we actually divided right here, the pedunculated ones. The sessile ones are right on the mucosa like we saw before.
Okay.
And then we have one more picture.
And this one here.
This is after removing this pedunculated polyp. So it's the same type of scenario where this is the scar that's left over, and then the lining heals on its own, and there's no pain with that.
Very interesting graphics. They're very interesting. But it also shows that while this procedure is happening and the polyps are being removed, that there is no pain that you're going to feel afterwards, other than the uncomfortableness of some bloating.
Right.
Wow.
That's exactly right.
So it's not all those myths that are out there that people are led to believe. Oh, it's it's a bad procedure and you're going to feel miserable afterwards and so on. Not true. So I think based on what we were discussing, I think the whole worst part of this is the prep.
The worst part is the day before. That's right. It's the day before. And then generally people can go back to work the next day.
All right. So we now learned about how is colon cancer detected and what it is that you can do. So what happens, doctor, and I've had these questions and people have asked, is that what happens when you go in, you do a colonoscopy, what's the percentage of finding all the polyps and removing them? And is there a possibility of those polyps being left over?
Right. That's an excellent question. Excellent question. Most of the time we are able to find polyps. It depends how many the person has and how big they are and how good the bowel prep is. Most of the time we can remove them. However, there is a certain percentage that we do not get.
Mm-hmm.
However, that's why we have screening colonoscopies every so often. So depending on what we find on the colonoscopy, if there are polyps, then the following surveillance colonoscopy will be at a shorter interval, so
Okay.
less than 10 years.
All right, so let's say, for example, you have a 40-year-old female who has had a colonoscopy and had 3 polyps removed. What would be the follow-up recommendation thereafter for follow-up?
So if the three polyps are removed and under the microscope it shows an adenomatous polyp, which is a certain type of polyp that has a risk of developing into a cancer, 3 polyps generally means 3 years. So you get 3 years and then you need a follow-up colonoscopy.
Okay.
Because if you have polyps, a personal history of polyps, like we mentioned before, you have an increased risk of cancer and an increased risk of polyps. So, one, you do it at a decreased interval so that you can follow up and make sure that you didn't miss anything in the first place.
Right.
And 2, so that you can get any new growths.
Wow. Again, I want to remind our viewers that with us today from Advocate Illinois Masonic Medical Center, from the Center of Advanced Care, we have Dr. Jan Kaminski, who's with us today, and we're talking about colon cancer and prevention thereof and screenings. So does that mean for every polyp it's a year, or that just...
No, it's not exactly that way,
Okay.
but it is. It
Okay.
does have. It's a number
Okay.
and how big the polyps are.
Okay.
So the greater the number of polyps and the larger they are, the smaller the interval for the colonoscopy that we
Okay.
need to do.
And of course, we said genetics does play a role in this. So obviously, if you have a father, mother, aunt, uncle, it's definitely something you would recommend it. If it runs in the family, how soon would you say someone should have a colonoscopy?
So these cancers do run in the family, and if you have colon or rectal cancer in the family, you have a slightly higher chance of developing it, especially if the family member got the cancer when he was less than 50 or at a younger age. So if it was at a younger age, then generally you as the individual, especially if it's first-line relatives,
Okay.
like mom,
Okay.
dad, sister, brother,
Okay.
then you want to get it 10 years before the diagnosis of your relative. So for instance, let's say you have a mom that was diagnosed with colorectal cancer at age 40. That means you, as the son or daughter, would want to get it about 10 years before.
Right. So you want at 30.
Right.
Right. So I'm ready to go for my colonoscopy. So where do I go to get something like this done, and who do I need to talk to or see? Is it my primary care that starts the ball rolling here?
Yeah, generally it is your primary care doctor. You just ask them for a referral for a colonoscopy. It's very easy to do, and you can get, they'll be able to send you to either a gastroenterologist or a colon and rectal surgeon, or anybody who does these routinely.
Okay. And if somebody wanted more information, Doctor, can someone call you if they wanted more information or had additional questions?
Yes, absolutely. For example, my office is located in the Center of Advanced Health at Illinois Masonic Medical Center.
Right, we got it right here. Somebody wants to write it down?
Okay, great. And it's located right by Illinois Masonic Medical Center. You can call the office anytime, and the secretary will be able to reach me, and no problem, and we can answer any questions that you have.
So again, you can reach Dr. Jan Kaminski over at Advocate Illinois Masonic Medical Center, Center of Advanced Care at 900 West Nelson Street. That's near Wellington and Sheffield in Chicago. And if you have any questions for him, please give him a call. You can reach him at 773 area code 296-7095. So doctor, if you were to give advice to our viewers, what are the things you want to leave them with today? What are some of the important points, takeaways?
The most important point that I'm very passionate about is that getting your screening colonoscopy. If you haven't gotten a colonoscopy, you're over 50, really just go ahead and get it. It's something that can prevent a lot of headache. It can prevent you from having cancer, which means prevent you from having a large operation, prevent you from having chemotherapy, prevent you from bouncing from doctor to doctor. But the other thing that I want to leave the viewers with is that if you are diagnosed with colon or rectal cancer, it's a very, very treatable condition. And we have new techniques and we have new methods to get the cure.
Right. And now you did say to me earlier too that now there are also options even for the prep kits, right? So it's not always that heavy duty white chalky prep.
Right.
There are other options out there.
A lot of people have that. A lot of people who've had a colonoscopy before in the last 10, 20 years do remember that the bowel prep was not the most tasty and not the most thing to be able to tolerate, especially with the volume. The old prep used to be 4 liters, and it used to be chalky, milky, like you said. But now we have different options. Ones are that there's much less volume, and it tastes better. For instance, I use a prep that uses Gatorade. So my patients generally are able to tolerate that much better, and the actual volume of it is much less. It's not 4 liters, but 64 ounces.
That's like drinking water.
Right.
It can't get any easier than that. So, Doctor, I want to thank you for being on the show today. I know our time here goes by really, really quick, but I'd love to have you come back and let's continue this discussion on colon cancer and rectal cancer. Very, very important topics to continue to discuss and to educate our viewers. And thank you for watching. But I know that, Doctor, that we can reduce the risk through regular screenings for colon cancer. This can be prevented if caught early. And thanks to the improvements in prevention and early detection and treatments, more than 1 million people in the United States count themselves as survivors of colon cancer and rectum cancer, also called colorectal cancer. I want to thank our viewers again. On behalf of my colleagues at Hispano Care at Advocate Illinois Masonic Medical Center and Dr. Jan Kaminski, thank you so much for being with us on this show today. I hope that you took away a lot from this show. And we look forward to coming back and sharing with you so much information. Thank you, CAN TV, for making these shows possible, always to our viewers. And obviously, learn, educate, and prevent. Until next time, we'll see you again soon. Good night.